I'm Dr. Ashmit Amankar. I'm a consultant urological oncologist and robotic surgeon. May month is Bladder Cancer Awareness Month, and in this series, we are discussing about various ways of presentations, treatments, and follow-ups for bladder cancer. We spoke about non-muscle invasive bladder cancer and essentially spoke about two types of therapies: intravesical chemotherapy and intravesical immunotherapy. How do we decide which patient is to be offered chemotherapy and which patient is to be offered BCG therapy? In general, American surgeons and Indian surgeons are more in favor of BCG because that has been described since multiple years. But of course, it comes with some consequences. BCG creates an environment in the bladder which is hostile for the cancer cells to survive, thereby pushing cancer cells away. That's a simple mathematics. But a flip side, because of that bad environment called as cytokine storm, the healthy bladder cells also get a brunt of it, and hence the patients will have multiple side effects of urinary domains on when they are on BCG therapy. Typically, these will manifest in terms of excessive frequency of urination, excessive nighttime urination, sometimes burning in the urination, or sometimes proper infection and fever related to the urinary tract infections. That's why the BCG therapy has to be given very, very diligently in a very systematic way to minimize the chances of infections. Simultaneously, a continuous dialogue has to happen between the clinician who is offering the BCG therapy and the patient to decide whether we would want to reduce the dose or give a break for a while for getting the side effects better. Generally, the intravesical chemotherapy, which is a second alternative, does not have acute toxicity on the bladder per se immediately. However, the pros and cons of each needs to be discussed. So typically, a patient who is more favored for BCG is a relatively younger individual who doesn't have baseline urinary problems to a large extent and who understands the consequences of BCG installation. Typically, an old patient who has background urinary concerns, who will be probably difficult to deal with when the urinary domains worsen, are more in favor of intravesical chemotherapies. The schedules for both are different. They are designated and they are described in literature, and the clinician has to follow these schedules. BCG, to minimize the toxicity, there have been efforts to minimize the dose simultaneously, also to give some antibiotic prophylaxis during the therapy, and most importantly, to follow some sterile precautions while giving it. All these maneuvers will help the patient to undergo BCG therapy in a defined way with minimal side effects. Thank you so much.